another Tooth Talk with your dentist on thedentaire.com. I'm Dr. Rekha, and the Tooth Talk with your dentist is an initiative to increase oral and dental health awareness among people. Do visit our website www.thedentaire.com to get more information about your oral health and subscribe to our YouTube channel to get the latest updates. And today, in conversation with me on the Tooth Talk is Dr. Balakrishna. To give you a brief introduction about Dr. Balakrishna, Dr. Balakrishna is a practicing periodontist with a rich clinical experience of over 17 years in the field. Dr. Balakrishna did his BDS from the prestigious VS Dental College, Bangalore, and his post-graduation in periodontics from the College of Dental Sciences, Davangere. He has, to his credit, being the topper of his branch in his PG exams. He is currently professor at the Anil Neelkonda Institute of Dental Sciences, Vishakapatanam, Andhra Pradesh. He has special interest in microscopic endodontics and sports dentistry. He was the past vice president of the IDA Voltaire branch. He has actively participated in many dental camps and workshops. He has a rural practice in Chaudeshwaram and was awarded the Outstanding Dentist Award from Chaudeshwaram. Dr. Balakrishna, welcome and thank you for being on this Tooth Talk with your dentist conversation.
Thanks, Dr. Rekha. It was nice an introduction to me. I'm overwhelmed, you can say, with the introduction which you have given to me.
I think that there's a list of achievements that you have done in the past so many years. And I think you rightly deserve that.
Thanks.
So, what exactly would you be talking to our viewers about today?
Today, I would like to talk regarding the sports dentistry, number one, which is a highly neglected subject in the 21st century Indian context.
Sports scenario, yes. Yes.
99.9% of the Indian households do not know. I mean to say, you could say the coaches themselves do not instruct the kids and the parents to wear a mouth guard.
Yes. So where exactly do you think there is a requirement for a sports guard?
Any child who goes, I mean to say, onto the road, okay, to play, to any contact sport. It need not be only a skating, onto a skating rink or anything, even a cycling.
Okay.
Cycling,
hockey, football,
basketball, cricket, and all this. Any contact sport which requires a tussle, a minimum tussle, okay, requires to use a mouth guard.
Okay.
And next thing is any child who is prone to have a seizures.
Okay.
We suggest it is mandatory to put a mouth guard irrespective whenever he or she moves out of the home, because it's expecting the child not to fall on the road or hit a pavement or anything. Okay, the mouth guard prevents the ingestion as well as the fracture of the teeth as such. It protects the dental alveolar process.
Okay. So you're trying to say that any child who goes into active sports, it is more or less mandatory that even during the practice sessions they use what you call as a sports guard. So what exactly do you think are the precautions they should take in terms of when they go to play a game?
It is a must and should that the kid should go to the nearby dentist. It's not that the pediatric dentist has to give a mouth guard.
Okay.
It is mandatory for every dentist to screen every child who is going to the contact sport, especially in the faster developing cities, in the higher most metros. You now have a skating rink and a cycling rink.
Okay.
The coaches have to be informed that not only the coaches, the parents have to be taught that it is mandatory to wear a chin guard, number one, for a cycling, and two, a mouth guard for the mouth, and a knee guard for their knees.
Okay.
Because the very reason, because they are more prone for injuries.
Okay.
And since it's a developing cartilage bones, they're more prone to get fractured.
Fracture. Okay, so you mentioned about using a mouth guard. Now I think there is some confusion regarding the terms that they use. There is also something called as night guards that people would wear. So is there any difference between how a night guard or how a mouth guard would be fabricated and in whom it has to be used accordingly?
See, sides of the coin, to be honest. A mouth guard has to be used when it's used when we are going to outdoor, whereas a night guard is to be used when before the sleep or during the sleep, when
Hmm.
the patient or the kid goes to sleep. The indications are also the same, are quite different. A night guard is used when a patient is having a clenching of the teeth in the night. That's what we call as a bruxism. Two, we want to do something, a bleaching procedure, overnight bleaching procedure. That's where we use a night guard. And three, the patient is having a sleep apnea or is grunting more. Okay, we use a night guard. But whereas a mouth guard is sports guard or mouth sports guard, whatever you call it, okay, is used whenever the patient or the child or any teen goes outside,
Hmm.
okay, or when there is a poor neuromuscular, I mean to say, coordination in the child. Okay, it's better we give a mouth guard, not a night guard. And the thickness of the mouth guard is quite different than that of the night guard.
So
So
so.
it's
uh,
more thicker. It's more thicker, and it
hmm.
gives you protection of all the teeth. Whereas the night guard protects only the superficial part of the tooth.
Hmm.
So there is a lot of difference. The materials used are
Hmm.
quite completely different.
Okay. So which means to say the way a night guard would be fabricated and a way a mouth guard would be fabricated are two different procedures altogether. And people have to
Different.
know that they can't use it interchangeably.
No, you cannot use it. You cannot use it interchangeably. The thickness of the material differs completely.
Uh,
It is just a 0.0 or maximum zero point 0.5 to 1 mm thickness in the night guard. But whereas the thickness in a mouth guard and a sports guard is completely different. It's more than 2 mm.
Okay, so Dr. Balakrishna, how would you tell our patients, very briefly about how exactly mouth guard would be fabricated? So because I think it has to be custom made because it is requirement of each patient and requirement of each child. So is it always better to go for a custom made mouth guard?
Yeah. The thing is that number one, number one is that any custom, you get a stock mouth guard in any of
That
the
means something
sports,
that's
good
ready
sports shop.
available in the shop. Huh.
Any stock, you can go to any sports center. At least you start with it.
Hmm.
If you feel it cumbersome, if it doesn't mean that all the stock guards are going to fit into your mouth.
Hmm.
Okay, you want a separate thing onto yourself. Okay, because your teeth are inherent part of your body.
Yes.
So go to the nearby dentist. It doesn't mean that you have to go to a pediatric dentist. Go to a nearby dentist, ask him for a mouth guard for your own this one. Okay, he or she will be the right person to select the right mouth guard for you. Do not every time rely on the stock mouth guards. That's the
Okay.
common misconception all the coaches in India have. Okay,
Okay.
so it is better the coaches get or send their wards, their students to a nearby
Dentist.
dentist.
Nearby
Yes,
dentist. So, so,
yes.
so, so, is there a possibility that if some patient comes to you with a mouth guard that they have already picked up from the shop, is it possible to alter it to their measurements, or it has to be
No,
done only entirely in a different way?
just as every child is unique, every mouth is unique. It is like
Correct.
just like a fingerprint. So
Correct.
you cannot do the alterations for that. It is not like your ready-made pants or a shirt where you can alter the pant size and etc. So it's very very clear that you have to get it a perfectly a custom-made fabrication for your mouth guard.
So, doctor, what exactly? I mean, very briefly, you can tell our patients, what exactly would be the procedure, that a dentist would do in fabricating a custom mouth guard.
Number one, it is absolutely a painless procedure.
Mm.
Number one. Number two is that your dentist is going to take an impression of your teeth, or
Mm. Like
I mean,
measurement.
what? Yeah, you can
Mm.
take an alternate impression or whatever this one. Send it to the lab. They'll fabricate to you within 24 hours to 48 hours. They will trim it. Then it gets back to the dentist. The dentist trims it, and accordingly he places into your mouth. That's
Mm.
it. It's a very simple procedure. Within 48 hours, or if you are living in a metro city, it's hardly 24 hours. It's a 4 hours procedure, to be
Okay.
honest.
Okay. So what exactly are the instructions that you would give your patients after giving them mouth guard as to how they have to take care of the mouth guard and when they have to wear it?
Before you start the game, okay, before you start the game, or at least before you start with the procedure, whatever game you are playing, put on your mouth guard.
Mm.
Okay, it is, and it's more important when a child is having braces. Okay,
Okay.
and in set of malocclusions like a class 2 malocclusion where the teeth are protruding out, it is more apt for these types of kids, okay,
Yes.
to go for a mouth guard. And those kids who are having a back chin, okay, or a double chin, who are having it, we strongly advise them to go for it. Okay,
Okay.
it, and for some habits like a mouth breathers, okay,
Mm.
we advise mouth guards. The reason is that it makes them use their nose to breathe. Okay, in one way we are correcting the habit of the patient.
Yes. Yes.
So
Yes.
it's better we advise them to go for a mouth guard. And
Mm.
especially cycling, skating, uh, means whatever where we have a severe contact, where it's dragged on, where we're going at a high speed. Okay, it's better we, including go karting. Okay,
Uh-huh.
now it's a fad. Now it's
Bad.
a fad among the metros. So what I would suggest to you is that have a mouth guard. Okay, remember Schumacher had his in his F1 circuit had a mouth guard and climbed into the pit. Okay,
Okay.
without mouth guard, it's not advisable for any person to go into the racing cart.
Okay, okay, okay. That was very informative, Dr. Balakrishna. And of course, you also mentioned about a chin cup that people have to
Yeah,
use.
yeah.
So that is something. Can you just explain to our patients a little about that also, as to who has to wear it and when they have to wear it?
Any child who's skating, any child who's cycling has to have a chin cup associated with the helmet that is provided. Okay, it is available in every cycling store. Okay, not just your mouth, not just your head. Okay, your knees are equally important. So
Important.
you need to have a knee guard and a chin guard. Without that, I would advise every parent, not only in India, and whoever is viewing this audio video clip, to change their habit. Okay,
Mm.
overnight you cannot change the good habit, right?
Correct. Correct.
So good habits stick very hard.
Yes, yes, yes. So I think that was the whole idea also of this particular True Talk with your dentist, so that as professionals we do have some amount of social responsibilities. So I was really very happy that I could have with you today, Dr. Balakrishna, and then you did tell our patients the importance of wearing a sports guard or a mouth guard when the child goes out to play, especially contact sports.
Yep.
I really hope I can get you back on this Two Talk series for another talk, since you're a pediodontist and also you have interest in microscopic endodontics. Maybe on any other topic related to child dental care and also about root canal treatment procedures. I just
When should the child first visit the dentist?
Oh
That is
yes,
the first thing
correct.
everyone has a
Correct.
doubt. Okay.
Correct. So probably what I'll do is I will hope to get you back. I know you're very busy with your practice and your college whatever
Yeah.
responsibilities you have. So I just hope I can get you back for another talk, and we could probably surely discuss about this. As to when is the right time to take your child to the dentist.
Yeah.
Yeah.
That's the
Thank you.
ideal part.
Yeah. Thank you.
Because none of our South Asian communities don't know when to take
Yes.
it's quite different. So the
Yes.
thing is that the world has much changed over the
Same.
years.
Yes. Yes. Sure.
Thanks,
Sure.
Rachel.
Thank
Once
you.
more,
Thank you.
cheers.
Thank you. Thank you.
Right, right,
Thank you so
right,
much. Thank you.
right.
That was Dr. Balakrishna, who did talk to us about the importance of using a sports guard or a mouth guard during contact sports. Do visit our website www.thedentaire.com to get more information about your dental and oral health, and do subscribe to our YouTube channel to get your latest updates on dental health. And I hope to come back with another talk with another dentist on another interesting topic in oral and dental health. Till then, keep smiling and be happy. Thank you.